Hypertension is more damaging to our arteries than high cholesterol. 2 out of 3 people in the United States die of vascular disease, strokes, or heart attacks. Vascular disease occurs when the inner lining of our blood vessels are damaged by cholesterol or by the constant battering of high blood pressure. Even if we have low cholesterol, high blood pressure can harden our arteries and make us old before our time. The width of the walls of our small arteries in our brain is equal to only a pencil line, which makes these arteries very susceptible to even small changes and increases in our blood pressure. 40% of dementia is vascular dementia from high blood pressure or high cholesterol. So hypertension can make you senile. High blood pressure can often be controlled with a low-salt diet or weight loss, or even 6 pounds of weight loss. Exercise, increased calcium intake from calcium supplements or dairy products, increased potassium intake from nuts, lentils, etc., and magnesium may also help lower blood pressure naturally. 80% of our salt intake is in the food and not from the salt shaker. We must read all labels and try to eat less than 2,300 milligrams of sodium a day. Stop smoking. Be aware that multiple studies show that aggressive biofeedback does not control high blood pressure. So trying to stay calm will not help chronic high blood pressure. The most important thing to know about high blood pressure is that it is a silent killer and disabler. A person can feel great and then have a devastating stroke a few moments later if the blood pressure is not in control. Frequent and regular blood pressure checks should be done. You can take your blood pressure in your doctor's office, but he cannot follow your blood pressure as frequently as you can at home. Also, 21% of patients just have white coat hypertension and do not have any other blood pressure problems other than in the doctor's office. Therefore, it is important to get your own blood pressure machine and take your blood pressure at home. I like the Rely-On or Omron wrist monitors, which you can get on Amazon. The Omron arm monitor is also good. Take your blood pressure 2 or 3 hours after waking up in the morning, as this time is likely to be when your blood pressure is the highest. 3 hormones wake us up: adrenaline, cortisol, and growth hormone. Some people, however, have higher blood pressures in the afternoon or evening. So find out when your blood pressure is the highest and check it mostly at that time. Be aware that blood pressure medicine is 1,000 times safer than having high blood pressure. Too often patients are afraid of taking medications and suffer the dire consequences of this decision. One should never raise or lower or stop your blood pressure medicine without talking to your doctor. Take your medicine as prescribed. Report any troublesome side effects to your doctor. Sometimes patients do not feel quite right when the blood pressure medications are first taken. If my normal blood pressure was lowered a bit, I would feel the same way until my body accommodated to the new blood pressure. We always try to find out why you have high blood pressure. 95% of blood pressure, however, is essential hypertension, and a cause is not usually found. These patients mostly have kidneys that do not excrete salt as efficiently as they did when they were younger, or they have less efficient metabolism of vasoconstricting chemicals in the body. Occasionally, we find that high blood pressure occurs from narrowing of the artery that supplies the kidney. This is called renal artery stenosis. The narrowing occurs because of a thickening of the muscle fibers, fibromuscular hyperplasia, in the artery wall in young people, or hardening of the artery with cholesterol plaques in older people. You may get some tests to find out why you have high blood pressure. This may involve 24-hour urine collections, kidney scans, and blood work. The adrenal glands sit on top of the kidneys and can cause high blood pressure several different ways. By either excreting cortisol, and this is called Cushing's syndrome, or adrenaline-like hormones, and this is called pheochromocytoma. Pheochromocytoma can cause flushing and racing of the heart. The adrenal gland also can secrete mineralocorticoids. This is called Conn syndrome, which causes the body to retain sodium and lose potassium. Also, hyperparathyroidism can cause hypertension by raising your calcium levels. The parathyroid hormone comes from 4 small glands that sit behind your thyroid gland in your neck. Excessive quantities of salt, alcohol, and caffeine, and even small amounts of nicotine can raise blood pressure. And some people are exquisitely sensitive to caffeine. Obesity, however, is the most common cause of hypertension. According to our latest guidelines from the Joint National Commission, we say that blood pressure should be 115/75, and the risk of stroke and vascular disease doubles for every 20 points over the top number and every 10 points over the bottom number. However, if you are 80 years old, we allow the blood pressure to be 130/140 systolic. In our patients in their 90s, we find that some need blood pressures 150/160 systolic, or they faint. There is a sweet spot for blood pressure for older patients. Diuretics, ACE inhibitors, angiotensin receptor blockers, or ARBs, calcium channel blockers, alpha agonists, beta blockers, and vasodilators are used for blood pressure control. Each of these are chosen sometimes to simultaneously help other medical conditions. For example, the ARB can help stabilize cholesterol plaques in the arteries and prevent strokes and heart attacks. 70% of patients need at least 2 blood pressure pills to control their blood pressure. I hope this discussion has been helpful. I'm Dr. Edward Gaber, and I will have another session on hypertension.